A bill that Minnesota leaders say will save Hennepin healthcare right now is sitting on the governor's desk.
Today, Governor Walz visited HCMC, touting what the legislative deal means for this crucial Level 1 trauma center in the state's healthcare system.
But that tonight there are others raising concerns that it's not enough for rural hospitals. And our chief political reporter Tom Hauser starts our team coverage now, asking how the state will monitor hundreds of millions of dollars in taxpayer funds for HCMC. Tom?
Yeah, Leah, Governor Walz spent some time with HCMC officials today in what you could say was a political house call. He also explained why he thinks the money in that new legislation will be money well spent. As it became clear, HCMC is hemorrhaging cash to the tune of $50 million per year, it also became clear the legislature and state government would need to come to the rescue. The triage comes in the form of $205 million this year and a $500 million reserve fund available in upcoming years. What guardrails are in place to make sure these hundreds of millions of taxpayer dollars are going to be spent efficiently so there's not another crisis looming in a year or two?
I want to make very clear on this, and anyone making any suggestion to any way that this situation here at Hennepin County because of financial mismanagement, that's not the case at all. It's a broken healthcare system, as I said again. Of all the uncompensated care across Minnesota, 20% of it comes here. You can make your hospital finances work if you turn people away at the door. Well, we have a moral obligation and a legal obligation. We don't do that.
The cost of caring for uninsured people is unavoidable. Still, the governor's senior healthcare advisor says the HCMC bill creates reporting requirements and a task force to study long-term financial stability.
There will be a lot of transparency in how the funds are being used and what progress is being made to stabilize Hennepin County Medical Center for the long run.
There was some concern HCMC's financial issues might impact the hospital's mission as a teaching hospital, but it will remain a core of what they do.
We kept 70% of our graduates here from Hennepin in the state. They train here and they want to work here. Nearly 40% went to rural greater Minnesota, and that is key for the survival of other health systems and the entire state's workforce.
Now again, the governor just received the HCMC bill officially today. His staff will review it and he will likely sign that legislation by the end of the week. Live in Minneapolis, Tom Hauser, 5 Eyewitness News.